People, and in particular children, face a lot of difficulties and challenges growing up in informal settlements. For an area that is so highly populated, it is ironical that the presence of government is hardly felt.
In a slum of 250,000 people thereabout, you don't find a facility, you don't find a nurse sent by the government. Other than those that are provided by NGOs and other community groups.
Having been involved with health programs and providing medical services in Kibera slum for many years, in 2007, AMREF initiated the Personal Hygiene and Sanitation Education Program, also known as FACE. The objective was to promote observance of personal hygiene amongst school pupils to reduce the high incidences of illnesses and diseases that are prevalent in slum conditions, particularly those caused by poor hygiene and sanitation practices.
The project involved government officers like public health officers in implementation of some of their activities. For example, they used public health officers in supervision of those schools to advise on the issues of health which need to be implemented in those schools. Food quality control, public health officers, we do food inspection in those schools. We do water quality controls. For example, we carry out water samples to determine its quality, to safeguard the health of the pupils.
In 2010, AMREF expanded the scope of the FACE program to the Kibera Integrated School Health Program.
It is a little bit broader to include social skills, to include nutrition, improvement on nutrition among these children, including menstrual hygiene issues among the girl child in the slum, looking at child rights, issues and all that.
AMREF took head teachers for a training to help us get equipped with information on how to go about implementing the integrated school health program. A parent also was taken from our school, was given a training, and the parents came back and talked to the other parents.
This training was basically about personal hygiene and sanitation, and we became the TOTs. After training, we qualified. So the first thing that we were to do, make the other teachers to be TOTs, give this information to the pupils.
These lessons that you have learned, it's really helping, because if you teach a person and you tell that person to go and tell others, the person go and tells his family, and the family go and tell friends, it will really spread.
Using innovative mediums like skits, song and poems, pupils impart valuable health messages to their peers and the community.
I transfer the knowledge to others, the one that I've chosen to go and teach in other class, so that when they come out of there, they have something in mind that they can go and teach the young ones.
Hao ndio walianza kuniambia, tukakaa chini tukafundishana, nikawaambia kwamba mshike hii masomo vizuri ili mnaweza kufundisha hata kwa nyumba zingine, ili wale hawajajua wakae wakijua.
School health clubs are important for continuity. They're able to do in their own small way, create messages that would keep reminding the children. The messages on personal hygiene and sanitation is also good for mentoring the other pupils to be able to learn as they come to school on their personal hygiene and sanitation.
As part of life skills training, pupils are taught innovative ways of keeping kitchen gardens. This is aimed at boosting food security and improving the nutrition of their families, utilizing the little spaces around their homes. Schoolgirls have been provided with sanitary towels. This has greatly enhanced the esteem of the girls and boosted their level of concentration in their studies.
Shukuru AMREF sana kwa kutuletea hizo vitu. Sababu sasa kama msichana ameanza hiyo stage, anaenda kwa mwalimu anamuitisha, anamwambia tu mwalimu nisaidie na pads, alafu mwalimu anampea. Sana kwa comfortable, hata anaweza kimbia, anaweza cheza na wenzake, anaweza jibu swali kwa darasa. Each and every class was having a bucket. Standard 4, 5, 6, 7 and 8, we went to excrete there on the riverside. Going there will take a lot of time and you will miss some education.
The Kibera Integrated School Health Project was able to build the VIP toilets and also to increase the number of toilets compared to the children, the ratio of the toilets and the children. AMREF was able to connect the schools to the normal Nairobi water and sewerage system for them to be able to access water, build them tanks for storage of that water, provide them with hand washing facility, because as part of teaching them on how to do hand washing, there have to be those hand washing points.
Schools have tried to initiate feeding programs in the schools to ensure that the children at least have a decent meal. Through the project, AMREF has been able to assist by rehabilitating some of the kitchens in schools to mount a successful school feeding program.
Kibera Community-Based Health Facility is where the Kibera Integrated School Health Project was based. So we were able to integrate the school health project as part of our activities, because then we'll be able to use some of the staff like the nurses, the nutritionists, the counselors, the clinic officers to be able to support the school health project. And most of the time would refer for cases like ringworm, would refer for upper respiratory tract infections, ear infections. So,
as a community health worker, we gather information in terms of the household members. In terms of sanitation, we normally follow up and see how they clean their toilets. And we have cleanups, of course, which is once per month. And if I get any case in terms of maybe they're moderately malnourished or they don't know their health status, they don't treat their water, I teach them, and if they're ill, I refer them to the health facility.
We wanted to address the issue of health issues within the school, latrine, water problem, drainage problem. And in case we have a program, let's say we have a need in each and every school, or a school that has a need, we go and visit and then we see how we can help them.
Last year, 2012, it has conquered all the years that I have been doing my exams. I had a very good number of those who did very well with the 250 and above.
This is much more than what I would actually express using words. I'm more than happy.